My top 10 serious risks associated with cardiac catheterization. And remember, like in baseball, all stars make less errors. I'm Dr. Evan Levine. If you enjoy this video, send me a thumbs up and share with friends. Let's get to it. Number one, bleeding or bruising at the catheter insertion site, especially risky for the elderly, obese, or anyone on blood thinner. Number two, an infection at that same catheter site. Number three, reaction to the contrast. Now, that can be anything from nausea, itching, hives, or in rare cases, something called anaphylaxis, and that can be deadly. Reason why I want to be at the best place with the best nurses, techs, and doctors. Number four, dissection or tearing of the coronary artery, and almost every doctor, even the best of ones, have had some of these. And it needs to be fixed immediately to prevent a major heart attack or a trip to the operating room. Number five, an abnormal rhythm, we call it an arrhythmia, which is usually temporary, but it can stop the heart or lead to something like ventricular tachycardia. And again, seasoned staff will pounce on this. Number six is a stroke, especially with elderly patients with that nasty plaque in the aorta. Number seven, kidney damage from the contrast dye. Now, high-risk people include people with pre-existing kidney disease or diabetes, and it's much less likely when an all-star doctor with the best imaging devices uses a lot less contrast than a less experienced doctor. Number eight is radiation dose. From a very simple to a very long procedure, you may have the equivalent of 20 to 500 millisieverts, 200 to 5,000 chest x-rays. In one case, the radiation dose was reported as greater than 170 minutes of x-ray time. So the patient developed a severe burn on the skin. That's like sitting through the Godfather movie and the previews with the x-ray tube constantly on. And more radiation means more risk of cancer down the line. Patients often never know this. Number nine, it tears in the artery like the arteries of the hand or the aorta and can lead to dangerous blood loss and death. And number 10, nothing. Nothing, like an old school buddy who told me once. He had an angiogram in an outside hospital, and they told him they could do nothing. They suggested surgery, and a few days later, well, after calling me, I sent him to my chief, and he was home the next day. All arteries open, no surgery, just stents. Now remember, when you sit on that table, you may not know if it's going to be a simple or complicated case, so you make sure you're on that all-star table. I hope that helps.